Okay, so hi everyone, this is Your Breath YouTube channel. And in Your Breath YouTube channel, we focus on healthy breathing and all the different ways that we can look at that. And one of the things I love about this is that there's many different people in different areas who are connected to this world of improving your breathing. So today I have Bridget O'Connor, who is a trained orofacial and myofunctional therapist. And she's going to speak more today, and we're going to have a chat about how the work that Bridget does is connected with healthy breathing and the work that we do here at Your Breath. So, hi Bridget, welcome. How are you doing?
Hiya, Brian. Thanks a million for having me on.
Thank you for coming. I really appreciate it that you're here today. And I suppose first of all, if you could just start by just sharing how, did you get into this area with this long word, orofacial myofunctional therapy, briefly, like how you got into it and what it's about and how that might connect with our breathing as well.
Yeah, I was a science teacher at second level honours leaving cert for 20 years. And my subjects were biology and chemistry mostly. And during that period, my husband was a dentist in Cork, and he started out on a road of orthopedics, a non-extraction based orthopedic program for children. So everything he said about it and about the way the face was growing and how crooked teeth presented, everything he said just made perfect sense. And I became very interested in the whole field of what we now call functional orthopedics and functional dentistry. Mm-hmm. So about 10 years ago, 11 years ago actually, we were developing our website, and we came across, we were just looking at different people's websites, and we came mm-hmm. across this thing called orofacial myofunctional therapy, which is a mouthful in itself. Yeah. But the word oro is referring to the mouth, facial is referring to the face, myo is just referring to muscle, and therapy. So what I do is I treat the muscles of the mouth and face. But obviously those muscles don't stop there. They're inextricably connected with the airway, and in fact connected right down to our toes. So there isn't any muscle that functions without impacting another muscle. So mm-hmm. over the 11 years, I've had many mentors, and I've trained extensively in the States with the AAMS. And there were times where I was making 6 trips to the States to train and learn as much as I possibly could.
Wow. So
and
like
Tony, sorry?
6 trips per year, Bridget, to the States to train.
Yeah.
Wow.
I went to everything. I did every course available. And in fact, any of the courses that Tony did, I used to attend those dental courses as well. So I really, I did my best to upgrade myself in every aspect, really, not just the muscle function, but just why the face, why it's so imperative that the face grows normally so that it can accommodate the tongue comfortably, and it can accommodate the skull, obviously, that the skull can accommodate the brain comfortably. And the skull is actually the housing for the brain and tongue. And if there's anything tweaked or distorted in the alignment of those bones, which very often are as a direct function of asymmetrical use of the facial and oral muscles, or even breathing muscles, we can have fairly disastrous effects, knock-on effects.
Yeah, so what I'm hearing you're sharing with us here is that, small changes in maybe habits, or, something that will, what may cause what you call an asymmetrical effect on that area of the mouth or the jaws or anything to do with the skull area, can have a large knock-on effect on the whole body. Is that correct?
Yeah, it's huge, really. I compare the muscles of the skull and face, because we must remember we're kind of dealing with two parts, the craniofacial part, the cranium or skull, and the facial part. So craniofacial is a word that we use an awful lot. And all of those bones, a lot of people think that that skull, the whole head, the skeleton, is a solid bone, but it's not. That's a very, very wrong interpretation. It's actually, even the face itself, which we call the maxilla, it's made up of 22 bones that interconnect with each other in the nearest thing I could say really is a kind of a serrated fashion. So there's always movement, albeit very subtle, in these cranial bones. And that allows muscles then to impact on what size they're going to develop into, what kind of shape they're going to have, and whether they're going to grow symmetrically or not. The muscle function has a huge impact on the overall development of the shape and size and comfort, right? Integrity really of the skull and face. So I kind of compare the muscles to the puppet, to the strings on a puppet. And provided they're pulled, right? Provided they're pulled symmetrically, we get the correct movement into the correct alignment of these associated bones.
Wow.
If that's...
and it's a huge area that you can explore with all of that. I suppose from the point of view of what I do with, you know, as a Buteyko breathing practitioner, and especially, I suppose, considering you work so much with children, and I work so much with children, and my background is in primary school teaching, I think today I'd really like to explore, you know, how the importance of what we teach of healthy breathing to children, how that kind of overlaps with what you do. And, you know, for example, one of the basic tenets that I teach, the basic simple idea to get across is to get the children to keep asking themselves, is my mouth closed? Is my mouth closed? So like if you go to one of my children's courses, that's the first thing, and you'll hear it at the end of the course, you'll hear it throughout the course. It all goes back to nasal breathing. How do you know for sure you're breathing through your nose if your lips are sealed? So the area for parents out there and for anybody who's interested in, you know, monitoring how their children are growing and are they developing healthily, what is the importance from your perspective, from what you do, what's the importance of lip seal and having your mouth closed when you're breathing through your nose?
I think we can never underestimate the intelligence of Mother Nature. And even in utero, but I'm not even going to go there today, but from birth, Mother Nature has laid out a series of, if you could call them exercises that enhance optimal facial growth. And when the face grows optimally, we have the upper jaw, they're going to meet in a very harmonious position. And as a direct result of that, it's going to be much easier for the lips to come together and form a lip seal. Now, I think anybody, you know, you don't need research to show that if your mouth is, if the lips are closed, you're going to be breathing through your nose. That's quite obvious. But another very important aspect of nasal breathing and keeping the lips closed is the tongue posture within the oral cavity itself or within the mouth. So from birth, Mother Nature has from what we call normal natural birth, the passage down through the birth canal, the movement in and out of the uterus, all of that muscular movement has an impact on the alignment of the cranial and facial bones. So that's really important. And then a skin-to-skin contact is really important with mother and baby, followed by the mode of nutritive feeding, which is breastfeeding. This is natural to all mammals, right? That mothers would breastfeed their babies. And this isn't, you know, this isn't to, I would always advocate for breastfeeding, but that, you know, not every mother is able to, or not every mother chooses to, and I totally respect that. But I'm just talking about the way, the impact that breastfeeding has on the development of the face, the movement of the tongue, the movement of the facial muscles. And I basically say to people that when mothers are nursing and the baby is suckling, it's analogous really to bringing the muscles of the face and tongue and the breathing muscles to the gym for as many times as the mother would feed her infant. Yeah. So that could be 4, 6, 8, 10, 12 times in a 24-hour period. And it might seem like cruel that the baby has to work so hard at breastfeeding. But remember, these are the muscles which are like the strings of the puppet, and they're pulling on the bones, and they're encouraging the type of facial growth that will result in a harmonious relationship between upper and lower jaw, and hence enough space for that tongue inside the oral cavity. And it also pulls the skull bones into the correct shape. And the greatest and fastest growing period in humans is between 0 and 2 years. So the face actually is encouraged to grow very, very rapidly, and the right environmental factors need to be in place for the face to grow optimally and have maximum harmony between the upper and lower jaw, hence maximum harmony for the tongue within the oral cavity. So when all the muscles are functioning, it, you know, obviously, if the upper and lower jaws are going to grow optimally, then the lips are encouraged to move into an optimal position and remain sealed. And hence, if they're closed, you can only breathe through your nose. And the development of the correct tongue posture is also imperative, because very often you ask people, where do you think your tongue should lie in your mouth? Yeah. And most people don't know. But in actual fact, the root of the tongue is very much embedded in the mandible, and a bone, a horseshoe-shaped bone underneath here called the hyoid bone. Yeah. So you've got a massive bulk of the tongue in the lower jaw. But in actual fact, the wobbly bit, or the bit that moves, is meant to be resting up in the roof of the mouth and not down in the floor. And I always say that the impact of that correct tongue posture is like if you had a trapdoor that was open and you had some kind of a rope here or whatever, and you pulled it closed, you're automatically pulling the trapdoor up. So you're bringing the whole contents of the lower jaw upwards. And in fact, correct tongue posture assists mouth closure as well. Yeah. And when a baby transcends into chewing habits, and that takes quite a while, but into chewing habits, they're literally exercising so many facial muscles that I refer to it as a sling. And when that sling is correctly, when it's functioning normally, that's another bonus to keeping the mouth closed, and hence nasal breathing. You know, you can't breathe when your tongue is up in the roof of the mouth, and when your mouth is closed, and when your lips are together.
Yeah. So that kind of natural growth of the face, you know, with all the kind of steps that go with it, encourages the lips to stay sealed, and encourages that natural. So, you know, there's because the idea of learning to breathe through your nose is the main idea that I teach on my breathing courses.
Yes.
But I suppose Mother Nature is kind of telling us that is just a natural way to breathe.
We're actually guided. And yeah. I often ask the kids to look into the mirror and just to very gently seal their lips, and to let the lips come apart very slowly. And you'll see what appears to be something like for all the world, glue. So even the lips secrete a substance, which help to keep them very, very gently. It's like a very low tack adhesive. Again, this is just the innate intelligence of Mother Nature and how we are so well equipped to have lip seal, correct tongue posture, and hence nasal breathe.
Wow. Now, there's one of the things that really struck me when you first spoke as well about, I think you did mention something about airway, because airway is a major, I suppose, hot topic at the moment with sleep issues. So there's a global, basically, you know, there's a global problem with sleep issues, like all over the world now. There's more sleep apnea. People are hearing more and more about sleep apnea, snoring, insomnia, sleep problems, you know. So one of the things we look at is how people breathe when they're asleep, and especially how children breathe when they're asleep. So the sleep disordered breathing and kind of overlaps with what you do as well. So we look at issues where people are not breathing well during their sleep. How does what you do, you know, as an orofacial myofunctional therapist, explore that area?
Basically, we've first of all got to assess why we'd say, let's take the child, for instance, why the child isn't managing to sleep, managing to breathe correctly, or has dysfunctional breathing while they're asleep. And not everything comes down to poor facial growth or inadequate facial growth, but many things do. And the reason it comes down to dysfunctional breathing can come down to poor facial growth is because, again, just coming back to the housing of the tongue, okay? I said it's a massive organ. It's very much gone under the radar with respect to how important it is and the impact it can have on our health. And if a face, which is meant to go forward and downwards, and the downward bit really is the lengthening of the face from here to here, or maybe more from here to here really, but it's about the vertical growth. So when we say downwards, we really mean it grows in length. So the face grows forward and it grows downwards. And when it does, you've got to remember that lower jaw advances and it comes forward. And when it comes forward, it brings the tongue with it. And the tongue has in children over about the age of 6 months, the tongue has a cobra type of shape. Prior to that, it has more a flattened shape and it's contained within the entire mouth. But there were two trade-offs with humans and those trade-offs involved compensating the position of the tongue. One of them was a trade-off where a tongue was like this, and that was a trade-off to become upright. And when we started standing up, the tongue came back like this. And the second trade-off was speech. And in order to speak, the larynx has to drop. And when the larynx drops, it pulls everything back with it as well. So there are two huge trade-offs. And in babies from 0 to 6 months, the entire tongue is contained within the oral cavity. And from about 3 months towards 6 months, it begins over a period of time to descend backwards. So in the resulting oral cavity, we really only have the front 2/3 of the tongue. The back third actually forms the front of the airway, and this happens to be the collapsible part of the upper airway. So straight away you can see if that face doesn't grow properly, we've got a fairly large amount of the anatomy back here. And if that face hasn't grown forward enough and brought the tongue with it, you can imagine how the airway at the back of your throat can become compromised. And this area of the back of the throat is only all muscle. Every other part of the airway has bony structures to maintain support. But the upper part of the airway doesn't. It's a muscular part. So if these muscles aren't trained properly, if they're not toned properly, they're going to become flaccid and floppy, and there's far greater likelihood that they're going to fall back into that collapsible part of the airway and take up vital airspace. And when they do, they're going to interrupt airflow. And depending on how much airflow they're going to interrupt will depend on how dysfunctional your breathing becomes, particularly at nighttime when you're asleep and the muscles are relaxing, you know?
So the nighttime breathing is something I wanted to connect in with next. As you were speaking there, it really made me think of, you know, encouraging children to learn to breathe with their mouth closed, to sleep with their mouth closed, to breathe through their nose when they're asleep. Because that's a big part of what we do, you know, and the different ways of encouraging it to, you know, how can we get our children to sleep soundly and to have nasal breathing throughout the night, and as parents to observe our children's breathing during their sleep. Now, from your perspective, because, you know, obviously we have our perspective with the breathing, but from your perspective, what is the importance of a child sleeping with their mouth closed if they can?
During the night?
Yes.
Sorry, when you said sleeping, I'm sorry. Yeah. I have a great analogy for that. And basically, as you well know, right, mouth breathing, during mouth breathing, the oral cavity is too big, so we dump off far more carbon dioxide than we need to. So we effectively change the physiology of the blood, with the result that we affect oxygen uptake in the muscles and the brain, etc., and that disrupts sleeping. So what we say really to kids when they come in is, you know, if you opened up a bottle of Coca-Cola or 7-Up, right, and you put it next to the bed, we all know that the fizz in Coca-Cola is carbon dioxide. So during the night, that fizz is going to escape from the open bottle, and in the morning, it's going to be flat, just the way the kids are. So while the kids are asleep at nighttime and the mouth is open and they're mouth breathing and they're losing carbon dioxide and they're affecting the physiology of the blood, they wake up flat in the morning. No fizz, no energy, because they have interrupted the physiology and the uptake of oxygen to the muscles and organs and brain. You know,
so something so simple, because this is a big part of what we teach, is what I teach in my course. Something so simple as sleeping with your mouth open can literally lower the energy levels in the morning, and it's literally lowering your oxygen uptake during the night while you're asleep. Now, from a primary school teaching background that I come from, my interest is also in the learning of children, how they learn, how they develop, and how they process the information that they've learned in school during the day. And this has a huge impact on their health and on their development. If they're not sleeping well and if their mouths are open, they're not going to show up the next day in class, first of all, energized, but they're also not going to be able to process that information each night that they've learned during the day. So the knock-on effect of something seems so simple is, you know, would you agree that, like, you don't have to agree with me, but like, what's your opinion on how that might affect children's learning and development, something so simple as mouth breathing during their sleep?
Well, I have to say the detrimental results of mouth breathing at nighttime just shocked me. There's an amazing study done by Karen Bannock. It's a longitudinal study. It's called the Avon study. And it was done over a 4-year period, and it investigated really the impact of sleep disordered breathing on children from 6 months up to about 4 years. And then 4 years later, it retrospectively examined how those children were behaving. And the conclusion really showed that sleep disordered breathing impacted them at a physical and or emotional and or behavioral and or cognitive, but it went right across the board, no exceptions, on every level. It's a phenomenal study. And I think it's something that really should be put out there, because the impact of dysfunctional breathing during sleep is hugely destructive. I remember a lecture by Dr. Stephen Sheldon, and he's a pediatric sleep physician also in Chicago. And he has said during lectures that his belief really is that when children wake up, particularly young children, when they wake up in the morning having had interrupted, disrupted, fragmented sleep, they don't know that that's what happened. That's their normality. So they don't know. And they have no words to articulate this to the parents. Oh God, I had an awful night's sleep last night. Whereas we can say it to each other. Children don't have that language, because to them, that's their normality. And they feel very tired during the day. And they can also, the only way they can compensate for the feeling that they just want to fall down and sleep is to become very active. So hyperactivity in children is very often a red flag to you that they've had a really bad night's sleep the night before. And that is something that really has to be on everybody's radar. And there are different ways of finding out whether your child is having a bad night's sleep or not. You don't actually have to have the conversation with your child, but they'll toss and turn in the bed, they'll wiggle in the bed, they might be bedwetters. For the girls that would have long hair, everything could be tossed at the back of their head. They could have sleep talking, sleepwalking, a multitude of red flags that are telling you they are not having a restorative sleep during the night, you know. And
one of the red flags we'd look at is just to observe, are they sleeping with their mouth open or their mouth closed? Yeah. That's another, add-on to all of those. And that's really helpful, Bridget, because that's like really to connect with you today is about trying to, get it out there about, how can we as parents or as grandparents or whatever, how can we, be more aware of how our children or our grandchildren are breathing, and what are the red flags we need to look for, what are the awarenesses we need to raise. So you've named a few there, just simple things about like are around the bed the whole time, are they bedwetting, even like you said with girls whose their hair is all messed in the morning, so that means they've been moving their head all night long. For us as well with the breathing, it's are they sleeping with their mouth open?
Of course, I would be looking for that too.
Yeah, of course, yeah. And all of those, like from the perspective of healthy breathing and how it links with myofunctional therapy and orofacial myofunctional therapy, what are the kind of awarenesses you'd like to kind of, or bring to parents' attention? What are the little things that they can be looking out for, not just in sleep, in day-to-day life, outside of sleep as well, like how would you maybe start to say, well, maybe there's some, issues here that I need to look at with the gross facial development or with the breathing? Have you any kind of tips there for parents that might be out there listening to this?
Yeah, there are plenty, really. One thing I am omitted to say just with the children is snoring is a major red flag. I forgot to say that. And it's so simple. I mean, parents come into me and they say, oh my God, my child snores like a train. It's like there's a train in the room. I mean, any snoring, right, is a red flag. So, there's very simple things to look out for. But coming back to facial growth, I see a lot of children that come in and they've got very, very poor myofunctional habits. But the kind of the biggest, most obvious red flag is crooked teeth. It's incredible. You know the face hasn't grown optimally if a child presents with crooked teeth. And if the face hasn't grown optimally, we can say, right, where is the tongue going to go if that mouth hasn't grown in the direction Mother Nature intended? So if the tongue is housed in the mouth, and as I said, it's shaped like this cobra, and it's in the mouth, right? And the mouth is too small, it can fall backwards or it can move sideways, but it'll show up, right, as crooked teeth. Okay, it'll present, the problem with the tongue will present as crooked teeth. And it's really, really important. But when the tongue lifts and, as I say, zip locks into the roof of the mouth, and we know that the palate is pink and the tongue is pink. So I kind of say pink, pink to pink. And that's really where the tongue should be, okay? So the border of the tongue zip locked into the border of the palate. And that really is the optimal posture for the tongue, because it's really pulling on this back third to rise up, helping us keep the mouth closed, rise up and free up the airway as much as possible. So when the mouth is up, sorry, when the tongue is up in the roof of the mouth, it actually takes on this beautiful horseshoe shape. And if you imagine a beautiful horseshoe shape, if this is now, if you could imagine my hand being a horseshoe shape, but if this is a back tooth in the upper jaw here, and this is the back tooth at the other side, and if I was to measure the length of that horseshoe shape from the back teeth on each side, the right and the left, I will get a longer length of dental arch than I will if the shape of the palate is V-shaped. It's a shorter length. Mm-hmm. Now, we're going to have the correct number of teeth erupt generally from the bones as we transition between child and adult. And it's imperative that the length of that dental arch is sufficiently long and correctly shaped to accommodate all of those teeth comfortably and correctly aligned. And if we don't get the development of that horseshoe shape and we end up with this V shape, those teeth will not be able to align along that V shape, and they've got to scrunch in like this, or you often see them jumping out of the dental arch or even jumping in, and you'll see them on the palate. It is the biggest red flag that facial growth has not proceeded normally and optimally, you know.
And it's, you know, when I first started doing this type of work, you know, when I first started teaching about the breathing, you know, that can be a sensitive issue for people. It's like, so you're kind of saying to me that, but the thing about this is I kind of always understood this because I wasn't breastfed. I know I wasn't, right? So I know that affected certain things, but whether that was the only reason or not, but I personally had terrible overcrowding when I was a child, and right into my adulthood, I had overcrowding where my two front teeth were okay, but the ones beside that had grown in, they compensated, and they were in behind.
Yeah.
And I would have had that V-shaped upper arch in my upper arch was V-shaped. I was that person who wasn't even sure where my tongue was meant to go. It felt strange when I was first introduced to this idea of keeping the roof of my mouth. Now, I was 30 years old. No, sorry, I was 35 years old before I learned about this. I'm 42 now, so it's been the last 7 years I've been on this journey. But from my perspective, I have noticed, obviously I haven't made the changes that a 5, a 7, or a 10-year-old child can make with their, but definitely I have more space there now through the work that Tony did with me, your husband Tony, and all of the work you did with me as well. I definitely have more space for my tongue, and my teeth are obviously straighter and all of that. So there's hope for everybody out there, you know, with the crooked teeth, and it's not a personal thing. It's not, you know, we want our children to have as healthy a life as possible, to sleep well, to breathe through their nose if they can. And it's just about getting the information out there. So yeah, the crooked teeth is from what you shared with us there, really is a major red flag for what's going on inside the mouth, obviously. Yeah.
Yeah.
So,
yeah. I have a poster behind me here, and I know you've seen this, but being the biology teacher, all right, in a past life, being the biology teacher, there are actually 5,400 mammals, right, known species of mammals, and 5,399 of them have perfectly aligned teeth. The only mammal that doesn't have perfectly aligned teeth are humans, right? So we have to question, you know, what is a mammal? Well, mammals give birth to their young alive. They're alive when they're born. They pass down the birth canal. They experience the head molding and the different inoculations in utero, the vaginal inoculations, the skin to skin, and all of the mammals are breastfed. So humans are well known to divert from all of those, right? And for different reasons, okay? But when we start diverting, we start disconnecting from that for which we are hardwired. Hence, we will, you know, we're diverting from what Mother Nature has laid out for us. To
so the natural process is, when you divert, there's cause and effect. So there's going to be some effect because you've caused the change by not going in the natural process.
Yeah. And I mean, it is what it is. You know, I'm just stating biological fact. You know, the further we digress from that for which we are hardwired, you know, the more impact it's going to have on us, really.
Yeah. And in one of the videos I share on my breathing course, it's pediatric dentist, I think, from the United States, and he's an ear, nose, and throat surgeon actually, and he's sharing about how, you know, when a tree is growing to the noonday sun, like if it's growing straight up, like it'll grow to the sunlight. But as our children are growing as well, you know, if you've got a mouth breathing habit, and the teeth are kind of making the adaptations, but once they start kind of growing that direction, it's not like they're going to automatically switch back then. So, you know, it's the importance of having lip seal from as early as possible in the children's life. That's the time to try and get in there, get the lip seal, get them breathing through their nose to allow for their growth and development to their full potential. And there's no judgment on anyone, the way we grow and develop. We all are what we are, but it's about reaching your full potential, you know.
That's it.
So
going
to the light in the way that you can, you know. So and it's just something for me. What fascinated me about this when I first learned about it was it's such a simple change to lifestyle and habit that can make such profound changes, positive effects on a child's growth and development. Just keeping the lip sealed. And, you know, when I see children in class, when I'm teaching primary schools, you know, the children who have really good lip seal and sit down in front, you know, when you're at the front of the class and they're sitting down with lip seal and they're breathing nasally, in general, like 90% of the time, they have better concentration.
Completely.
You know, they have much better concentration. The boys or the girls who, for whatever reason, find it difficult to breathe through their nose and have chronic, maybe nasal congestion or just a mouth breathing habit, they also, in the opposite of that, the corollary of that is that they, in general, tend to have, you know, more challenges when it comes to learning and to concentration. So,
you can definitely see a correlation. You know, I mean, as I said, I was teaching for 20 years myself, and you know, when I think back on it now, my goodness, if I only knew what I know now. And you know, when I was teaching about the tongue for honours biology leaving cert, it's like, you know, you had your taste buds and you used it for speech and you used it to manipulate food in the oral cavity so you could form a bolus and swallow, end of story. And my goodness, the tongue is such an important organ, and it just seems to be bypassed by so many people. The function of the tongue is humongous, and it never ceases to amaze me as an organ of health and wellness. It's incredible.
And I suppose just from your training and from, you know, your expertise in this area, obviously this is a huge wide area and there's so much to explore with it for anyone out there who was like, well, maybe my son or daughter has issues in this area and it's, you know, a big area to explore. But every journey begins with the first step. So, you know, the first step for me is to speak to the parents and speak to the children, teach the children about asking themselves the question, is my mouth closed? When you go home after, they come to me and I work with them. Okay, during the week, you've got to keep asking yourself that question. The more times you ask yourself that question, the more you are in the right track. Is my mouth closed? And they're great for doing that. Kids are really amazing at taking on that information. I find that I love working with the young people because they are very open to new ideas, which is great. And but for the parents, would you have any kind of like, you know, we spoke about the red flags, but you know, is there simple little exercises or simple little things? I know obviously it depends on the age of the child as well, but that children could be encouraged to do to just improve that whole area, the orofacial, myofunctional area, all of that, small little things. I have a few ideas obviously, but I'm sure you have a few you could share that might put the children in the right, you know, one step in the right direction.
Yeah, obviously the most important thing to recognize is that mouth open or not? Have they got a lip seal? It's not always as easy for a child to keep a mouth closed. So while we're advocating for it, because of the disharmony and the mismatch that can result from poor facial growth in the earlier years, they just might find that really impossible. Major problem is where the face fails to go forward. It kind of just goes downwards, but it falls back. And the more it falls back, the more it brings the tongue back and the more that impinges on the airway. So that brain is pretty clever and it's great at the survival instinct. So it kind of, it gets set up into this sympathetic mode of saying, oh my God, I'm actually choking on my own anatomy. This is really serious. So kids can develop myofunctional habits to protect their airway. And one such is this kind of anterior tongue thrust. They're kind of pushing that tongue, trying to get it out of the mouth all the time because everything is just back too far. So encouraging a child to kind of keep the lips together and breathe through the nose can be a very difficult thing for a child in that situation. So I think it's important that they're correctly assessed to know, are they actually able to do this? Or are they going to go against a driving survival instinct of, you know, optimizing airway patency? And the only way you can do it is by thrusting the tongue. Now, thrusting the tongue will cause a mouth very often to remain open, and it'll cause maybe the upper teeth never to kind of erupt fully so that they come down over the lower front teeth. So again, that results in a mismatch between the upper jaws. And when that happens, it's actually quite hard for them to keep their lips together and maintain a lip seal. Furthermore, if the upper jaw has progressed and for whatever reason the lower jaw is back or it's failed to grow forward enough or advance forward enough, that lower lip can be quite a ways back, and it can make it difficult for the lower lip to seal with the upper lip and to be comfortable closing. So I think it's really important that we kind of get a look at the way the facial growth has progressed and what is the child's true ability to keep the mouth closed, because it's really important, and it's really important that they breathe through their nose, but some children have great difficulty in doing just that because of the problems some of the problems that I've just mentioned. And what is extraordinary is the face grows, the upper and lower jaws grow in two different ways. The upper jaw has completed its growth phase by age 12. By age 10, it's actually 95% growing. So jumping in when all the permanent teeth have erupted, which is the advice most parents get, is very, very poor advice, because the upper jaw has basically completed its growth phase and has reached its full size at that, its full genetic size at that point. So what we like to do is we like to recognize the problems at a much earlier age. And even if we jump in at 6, which we do, our youngest little patient is 4, where we're guiding facial growth. But when even at 6, the face is about 70% to 75% grown at that point. So the child has 70 to 75% of the problem already. Why would you wait until they have 100% of the problem? Now, the second point is that while facial growth is completed in the upper jaw by age 12, the lower jaw continues to grow until age 18 or 19. So we might get a child that presents with what appears like buck teeth, or teeth that are way ahead of the lower teeth. But that can be twofold. It can be that the upper jaw has actually managed to progress fairly okay, but the lower jaw just hasn't reached its full size, or the lower jaw, for whatever reason, has failed to grow and keep up with the upper jaw. And chewing habits and the establishment of good chewing habits is very important in growth of the lower jaw. So all of these things impact on lip seal. And it's really important to recognize those, because lip seal is paramount to nasal breathing, you know. So we've kind of got to read a whole load of situations. So simply put, yes, keeping a mouth closed is really important, but it's not as easy for all children as one might think. And we've really got to make the full assessment. And with some children, I work with some children and their myofunctional habits are quite good. A few little tips, a little bit of mouth work, tongue work, tongue pops, and, you know, different sounds with the lips, etc. You know, just raising awareness is sufficient. But unfortunately, for most of the children we see coming in, they do need the program. They really need repetition. And unfortunately, our muscles learn through repetition. That's the way the neurology, the new neural pathways are laid down. And I always encourage the use of a mirror while they're doing their exercises, because the brain knows exactly the tension it's putting into these muscles, and it knows the duration, right, that it has had these muscles working. And the eyes are the seer of that, and they confirm with the brain that the exercise was done correctly, or no, you know, you thought your mouth was closed, but it's not closed. So the mirror really helps pick up and confirm with the brain if you're laying down the new neurology. So it's like learning how to write. It's like learning how to write. Yeah. And I very often
is that you could actually, you know, sorry to cut in, but you know, if you really wanted to, say if you're a right-handed person who writes with your right hand, like if you really wanted to, and if you started today practicing with your left hand, over time you would get pretty good at writing with your left hand. Now it's fine. It's not going to happen one day, and it takes practice.
That's what I have to. Yeah, that's what I have to tell the kids all the time. That it literally is practice, 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 and that's why it can be, it's a real commitment, and I feel sorry for the kids that they've got to do these exercises over and over again, but it literally is like going from writing with your right hand. The brain knows exactly the tension and the duration that these muscles need to be tweaked to get the writing perfect. And even when you take the pen up with the left hand, even though the brain knows it, the muscle, the wiring isn't there for those muscles to be tweaked at exactly the right tension for the right duration to make the perfect letter, even though your brain knows what that perfect letter is. And I'm going to take it one step further, right? So I get the kids to take out a sheet of paper and write out in their best writing in the right hand. And then they see themselves how poorly the muscle function is in the opposite hand. Let's just say it's the left hand, in the opposite hand, and they know that the only way they're going to bring this writing up to speed with this hand is practice. And then I give them a third task, and I ask them to write out their name again in their best writing in the opposite hand, and the moment they pick up the pen, I turn their head away from it. Now they can't see what they're doing. So it's going to take them much longer to learn how to write and improve their writing when they're not looking at it. That's my premise for using the mirror.
The mirror is so important. Yeah.
Yeah.
And
they must be looking.
That's great, because I always do that with, it's for a lot of children, like you shared that some children just physically find it nearly impossible to keep their mouth closed. And that's an area, you know, if there's any children come to my course, and if it's obvious to me that they just don't have the space, that it's just not physically even possible. I've seen a few children in that situation where you can just see it's just too hard for them to keep their mouth closed. That's when you have to start exploring other areas like what, you know, orofacial myofunctional therapy. There are some children though who have the space, and it's an awareness issue. But also it's a decongesting of the nose for a lot of them, you know, because they might have nasal congestion, chronic nasal congestion. Once they get the airways open and you can bring that awareness, and you were speaking about the mirror, I always get them to, I have a little mirror that I get them to look at and say, okay, keep your lips sealed now. And this is going to be your new, you know, resting posture of your beautiful face. This is what it's going to look like, you know, and it's, because how we see ourselves has such an impact, like literally how we see ourselves has such an impact on our behavior. You know, there's an internal vision we have of ourselves which hugely affects our behavior. That's like our paradigm, or, you know, of ourselves. But the fact of actually seeing themselves, this is how I look with my lips sealed. Oh, actually I look really pretty. And of course, when you smile,
and they do, they do.
Well, but, you know, not to have that resting posture of your mouth open. Can you, if you're physically able to do it, that's so important. And to see yourself that way, you know, because I would have had my mouth would have been open a lot when I was a teenager, probably in my early adulthood. Whereas now, because of the work I'm doing, I don't see myself ever, unless I'm talking. So this is another thing I teach in the course. When should your mouth be open? When you're talking, when you're brushing your teeth, when you're eating or you're drinking. But there was a boy that did one of my courses a couple of years ago, and he was a 5-year-old boy, and he said, Brian, you're after forgetting something. And I said, well, what's that? And he's like, you forgot to mention kissing. That your mouth would be open. It was a 5-year-old. He put up his hand. Yeah, he was the youngest in the class, and all the older ones were kind of like, oh. So I always share that story as well. It's like, look, how can we encourage our children to have that awareness, to have their lips sealed if they can? But as parents and as health practitioners helping these children, if it's obvious to us that they just can't keep their mouth closed, that's when it's so important to look into the work you're doing and other areas to really, because we, you know, we've explored the whole area today of why it's so important to have your lips sealed. And, you know, you're giving some amazing tips and amazing information.
A good one is the use of this muscle here. It's the mentalis muscle. And when we tighten it, it goes like a golf ball. And when children are kind of using effort to keep the lips closed, you'll often see this one functioning. So that's an alarm bell as well, that the only way they can maintain a lip seal is not using the correct sphincter muscle to keep the lips together. It's using this muscle, and this muscle is a muscle of facial expression, and it's there to express an emotion.
Yeah.
You know, and it's not a muscle to keep the lips together.
And like literally 4 weeks ago on a call through Zoom, teaching the breathing work to a child who was 9 or 10 years old, that literally was so obvious on the video call, was the effort he was putting in. And the muscle here was like all creased. And his mom even had awareness. She could see it on the video as well. So once, the great thing about this is once we can see the importance of seeing that, of having the awareness around that, and once the parents also understand why that might be an issue, your child is really struggling to keep his mouth closed. And then the good news is that he can, with practice, because he's getting help from, I think he's actually getting help from Tony and yourself as well, definitely from Tony anyway, with expanding that upper arch.
Very important.
That's the journey. Then you just kind of, you're like, well, you have the knowledge, so it's kind of to look into how can we make it that it's not so difficult for our children to keep their mouth closed.
I know. It can be such effort for some children, and we've had some extraordinary cases coming through the practice, Brian, and it's wonderful that Tony is able to do the structural, functional side and encourage that facial growth using appliances. And then I'm supporting the muscle function to maintain those structures. So, and even between the two of us, we're not saying we're the panacea. Lots of other things need to be put in place to enhance the health of the child. So it's very important to know where to send people and what else they'll need. But we have had some extraordinary health changes with children and adults. But there are parents that come back to us and they will say that their lives have just been completely changed because their child's life has been completely changed. And with it, it is a knock-on impact, they'll tell us, not just to them and the siblings, but to the grandparents and the aunts and uncles who are there trying to support the parents who are minding a child that is very sick, and nobody sees what's wrong with the child. And it can be as simple as mouth breathing, disrupted sleep, airway focused, and it can be destroying the child's life. And nobody is putting a finger on the real issue. And unfortunately, I think modern medicine focuses on treating the symptoms. And there's no way you can ever really heal somebody unless you understand the true cause of the symptoms that they're presenting with,
Yeah, and no, that's really true, and that's it. Getting into the cause, and like from the point of view of the breathing, like the breath is connected with everything that we do.
Completely. So I mean, if you think about it, Brian, it's the very first thing we do when we're born. And it's the last thing we do before we die. And it is the most vital nutrient. It surpasses what we're going to be drinking and what we're going to be eating. The brain has it's the alpha, it's what I call the alpha nutrient. And we've got to get that into our system efficiently and optimally throughout our entire lives. It's the first thing we do, as I said, and it's the last thing we do in this life. And we need, it's so important that we can do that optimally. It's our birthright to be able to breathe normally and efficiently,
Yeah, I know. And like you've just given so much information today, Bridget. I really appreciate it. And thanks for your time, and thanks for all the different angles we've looked at. you know, it's a jigsaw. From what I see, there's a big jigsaw, but there are underlying principles that, you know, for example, nasal breathing, lip seal, you know, being able to sleep with your mouth closed, that however, whatever way we have to put the jigsaw together to get to those principles put in place. You know, that's the way I look at this, is that how can the basic principles of healthy breathing, healthy orofacial, myofunctional use, all of that area, how can we get all that so that our children grow up healthy? And as more, and obviously, like you said, there's always other areas to explore as well. It's not one panacea, but it's one massively important area. So I really appreciate everything you've shared. And I'm sure there's going to be parents who look at this as well, who really appreciate just having this information.
And Brian, the earlier it's recognized, the more we can do. That's really, really important. Yes. And it can be recognized from birth. You mentioned grannies earlier, and I'm a proud granny. But when my first granddaughter was born, her parents said she was snoring like a train. And that's from the moment they're born. If your child is snoring, or if your child is mouth breathing and has the mouth open, they are red flags from the get-go, you know. So
and like, you know, we're breathing 20,000 to 30,000 times a day, so it's like, you know, that's between 7 and 10 million times a year, and that adds up very quickly, and all the effects that go with that. So I'm just so glad to be able to share this information on my YouTube channel, because it just connects in with all of the exercises that I teach and all of the work I do with the parents and with the adults as well, and all of the like the point of, from my perspective as an adult who's come to this, I made huge progress with the work that yourself and Tony do, with my jaw, with my tongue posture, with also learning to breathe through my nose, which was the breathing area that but there's so much can be done at any age. And obviously, the younger the better, that is for sure. The younger the better to get in with this. Like you said, why leave it until you have 100% of the problem? Get in and get it started. And it's a quicker process if you get in there younger, because children's faces are so malleable and they can just adapt to these changes. And, you know, the younger the better. But for people who it is too late from being young, so you might be in your 20s, 30s, 40s listening to this, it's all 50s, 60s, 70s, 80s.
Yeah, we've had them.
It's too late to make some changes.
Yeah, it's never too late.
I remember one of the conferences that you invited me to down in Killarney, there was one dentist, as far as you know, from the United States, who shared that, you know, he's had huge progress with people in their 70s and 80s. You know, even not the same extent you get with a 4-year-old, but like he was happy with huge progress. So
I think that was Dr. Jim Bronson, wasn't it? James Bronson.
Dr. Jim Bronson, isn't it?
Yes, yeah. He was using ALFs on. There was an older gent he had mentioned, and he'd very forward head posture there. Yeah, and he just literally. You know, his life changed really. You know, he just his posture improved, and his tongue space improved, and just the lip seal, nasal breathing, and a number of health issues improved as well for him. It's just such a simple change can make a profound difference.
Yes, and I think that's what I'd like to leave with today, is that like the breathing through your nose and the lip seal, it comes back to that simple change, back to that principle of what Mother Nature, we started with that and we finished with that, what Mother Nature encouraged, you know, naturally wants us to do, that going back to those basic principles can really change lives. So you're doing, yourself and Tony, I appreciate all of the work you did with me personally, you know, like as in for my own health. So, and all of the work, I know the work you're doing with all the children and with all the adults that go to you. Like I actually worked with an adult who'd been to you as well, who's literally her life was changed by the work that you and Tony did with her because of her sleep issues. She also did my breathing course as well on top of that. She was literally, like, she taught me just like literally, it was complete life change, you know, where she was like, at one point she'd even collapsed because of exhaustion at work.
Yeah.
Because she had sleep apnea and issues like this, and her whole life has changed. So, and I'm, you know, so it's information alone, you know, it's a powerful thing, but then it's like putting it into practice. So the work you're doing, working with the children, is putting it into practice and working with the adults as well. So, and this, thanks, Bridget.
Yeah, like, I mean, if you think about the switch from oral respiration to nasal respiration, and just the kind of functional orthopedics we're doing and correcting muscle function, they're all non-pharmaceutical and non-surgical procedures.
Mm-hmm.
And the impact, the positive impact, is just profound, because I really think we're getting at the true cause of the issues and the problems, as opposed to dealing with the symptoms.
Yeah, and that's the key, getting into the root cause.
Yeah.
So.
Yeah.
Okay, so thanks very much, Bridget. I appreciate it.
You're very welcome, Brian. It was great to see you.
Yeah, I'll talk to you. Take care, Bridget.
Yeah, mind yourself. Yeah, thank you so much for having me. Take care. Bye-bye. Thanks. Bye-bye.